Okay, I'm sorry, guys. So I think we are not late. Let's start. Okay. So first of all, guys, I welcome you all to this fantastic course what my team and we have created. The research, writing, and the publication. How to begin to how to finish. Like here, we are going to complete the entire process of conducting the research, creating the questions, and a little about biostatistics, and then about paper writing, journal selection, publication, and even using the AI. Okay, in that. So we try to include all the possible factors. I mean, see, there are multiple things like research methodology. We did not include the research methodology because that is separate part. Okay, and if we are including that, that will be a big course and big, discussion on different things. So we did not include that. But here we have tried the possibly, topics, all whatever we, need to include in a subject, in a question, in a, course, which is very much necessary to, all of us, that. Okay, one sec. I think I'm sharing the screen. Let me share the screen. Yeah, so we have included almost all the topics, okay, almost all the possible topics, like whichever is needed to discuss, in this course. So as we can see, this is a 2 weeks professional certificate course. There are 12 classes, half an hour, 12 topics. We will be covering in 6 classes, 6 days. So today we are starting this, and definitely this has been prepared. The entire course has been prepared, keeping all the students, academicians, and all kind of researchers in mind, right? So they can understand what exactly, how exactly we can start a research, and how exactly, we can publish the manuscripts, how exactly we can, search the journals and all, writing the protocol, ethical approvals, how to take the ethical approvals, calculating the sample sizes and all, right? So here is our schedule. I hope you all have the schedule with you. So, today we are going to discuss these two topics: research planning from the scratch, and research question framing and team building. Okay. And then protocol writing, ethical considerations tomorrow with some live exercises of ethical considerations. Okay. And then on 7th, means Sunday, data collection and cleaning, and then basics of biostatistics and importance of sample size calculations. Then we'll be starting the writing and publications next week. So on 12th, components of the manuscript, how to write the, how to write the acceptable manuscript. I think writing is missing here. How to write the acceptable manuscript. And then we will be talking about journal selection, publication, literature, and then editing and proofreading and all, right? So we are, 3 to 4 people, so 4 experts from the industry, from, the academia. So we are going to take this course, guys. So without a delay, I think we have talked a lot. Let's start the course. Let's start the thing. So let me share the PPTs. I have prepared a few PPTs for, just to ask you some questions, and then, we can discuss the topics, whatever we have, seen now. So I hope all of you can see my screen. Guys, I hope you can see my screen. Is it visible to all of you? Okay, great, perfect. Thank you very much, guys. Thank you. Okay, so today we are going to talk about the research planning from the scratch, and then the research question framing and team building. These are the three small topics. Those we are going to cover in next 1 hour. This is the module 1 today. So let's start. But guys, how can I leave you, without asking the questions? Only you do not have the rights to ask the questions. If this is my class, then it will be 100% interactive. Okay. So before I go to the class, let me test you. Okay. Let me check my audience, whatever is, my audience. So first question to my audience is, which is not, is in the slide. Okay, write me right here in the text box, write your background. What is your background? Which background you are from? Medical, pharmacy, nursing, which allied health science, or whatever is your background. Please write your background, guys, here. I want to know. Okay, pharmacy, nursing, biotech. Okay. Pharmacy. Most of the people are pharmacy people. Okay, pharmacy. Yeah, right. Pharmacy, biotechnology. Okay, great. No worries. Perfectly fine. Right. Absolutely great. Right. Right. Got it. Okay. So most of my audience, okay, medical microbiology is there. Vishnu Priya. Okay, perfect. Yes, great. Manipal Tata Medical College. Arjun is there. Hi, Arjun. So Arjun is here. So yes. So let's start. Let me fire some questions to you guys. Okay. Let me fire some questions to you. So here are the questions. First question is here. How many of you have worked on any research paper? Minimum one research paper. How many of you have worked on any research paper? Just write yes. Okay, if you have worked on any kind of research paper by yourself, please write yes. And if you have not done, then write no. It's fine. You can write no also. So I can see how mixed people are here. Okay, just 2 weeks research paper, but not published. Okay, so most of them are no, but a few are writing the yes only. Only few are writing the yes only. Okay, no worries. Working on a review paper along with my mentor teacher. Okay, yes, fine, perfectly fine. Okay, so my next question too is, how many of you have published any paper? If yes, yes. If no, then no. Publication. One is yes. Only one yes. I can see two yes, three, four, five. Only five yes till now. How many of you have published any paper? Yes, only abstract, case report. Okay, not yet. Checking process. Yes. Okay. So not much, only maybe 10% of the audience have published the paper. Okay. Now, guys, this is the question for the people who have published the research paper. You were the first author or the corresponding author in your paper, or just the author? What was your role? First author, first author. Okay. Yes, guys, right. First author. Okay. Write your role in the paper. Corresponding author. Okay. Corresponding, first corresponding. Okay. First and corresponding. Okay. No. Okay, that's okay. Right. Now, next question to all of you is, so very few are having the experience. What was your indexation of the paper published? Yes, indexation. Which indexed journal did you prefer to publish your paper, guys? Dr. Nancy, 1.67 is not the indexation. That is maybe impact factor. Okay. Scopus Embase. You are telling me journal ELC Vikram Thakur. Okay, Indian Journal of Clinical Biochemistry. Okay, Mohammad Noor is telling Web of Science. Okay, so you have no idea about indexation, only of one or two people. Um, Questions are getting tough. This is, I think, the last question. What was your impact factor? Someone has said me only one, right? Someone has said me only one. Anyone who knows the publication impact factor, like you have published any paper and how much was the impact factor of the journal? Anyone? No one. Oh, guys, come on. Okay, so the good news here is we are going to talk on all. We are going to talk on all the topics here, right? Ethics, corresponding author, indexation, impact factor, everything. We are going to teach you everything, how to select the journal, how to submit the paper, how to publish the paper. We are going to talk about everything here, whatever we have discussed. Now let's see how much do you know about the research. 4 5 questions. So here is the first question to you guys. Yes. Which step comes first when we start a research project? How many of you can answer this question correctly? Yes, guys. Which is the answer? 1 2 3 4 what? Defining the research problem, defining the research design, calculating the sample size, or obtaining the ethics approval. So you guys are saying the answer is one. Okay, the answer is one. Defining the research problem is the first answer. Okay, I mean, it's the correct answer. First one is the correct answer. Now, question number two is it necessary? Read the question carefully before answering. Okay, this is the statutory warning to all of you. Read the question before answering this. Is it necessary to take consent when involving a human being into the research in retrospective study design? No, 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 no. Okay, all are saying no. All are saying no. Only Hina is saying yes. Akshita is saying yes. Hmm? Yes. Soham Joshi, yes. Preshi D'Souza, yes. Susmita Joy, yes. Okay, so these people, I think I have manipulated you guys. I think I have manipulated you. So can the people who are saying no justify why we need the consent form when we are taking the human beings into the research in a retrospective study? Yes, guys, tell me. First of all, tell me what is retrospective study? Yes, what is retrospective study, guys? Do you know about retrospective studies? Okay, so my question here is what is retrospective study? Retrospective study. Yes, history, before time, case report, backward study, conducting research on past events. Okay. Okay, so let me tell you. I will say just right and wrong answers. Abhinees DZ has written using past medical records. Past medical records. Mm, not exactly. Partially correct. The past information is used. Okay, past means what exactly? You can write the meaning of past here. Past information is used. Slightly right answer. Backward studies. Completely wrong answer, Pavitra. Completely wrong answer, backward. Okay. I'll justify all. Sir, it's a retrospective design. Meanwhile, we are just collecting the data about something that has already finished or done. Yes, quite correct answer, Anna. Okay, conducting research on past events. I think it's completely wrong answer. Dua sake. Prezi D'Souza, backward study, not at all justified. Case report, no. Before time, no. Backward study, no. History, no. Dealing with past events, not at all. Backward study, not at all. All wrong. Make use of pre-existing data, partially correct. Done after research work, maybe, no idea. Information collected from the case reports, no. Taking past information of the patient, no. Partially correct. Research include analysis of data collected. Maybe you are right. The past people who are writing past, I don't know what in what senses they are telling past, but let me justify you. Okay, using the data already available. Okay, see guys. Okay, let me tell you. So based on the timelines. Okay, sorry. Based on the timelines. Look at this. Based on the timelines, there are two types of study. Okay, two types. One is retrospective, one is prospective. Okay, prospective. One is called as MB. Sorry, this is MB. AMB. MB studies. We call them MB studies or retroprospective studies. Those are also called as retroprospective studies. Okay, so these studies are kind of hybrid studies. Hybrid studies, right? So before you know about the hybrid studies, let me tell you one by one what is prospective and what is retrospective. So first of all, when we are talking about retrospective, you guys have written many things. Okay, retrospective means you are collecting the data, the complete entire data when the patient is not available in the hospital, he has been discharged and gone home. you are collecting the data from the medical records itself. Okay. You are collecting the data from the medical records itself, but the data is when the patient is not in the hospital now. Patient has gone to the, gone out of the hospital, either died or reached home, I mean, discharged from the hospital. Two things, two conditions. The people who are telling the past events. So see, past events, definitely these are past events, but you know what is the controversy here? Your sentence is half. Okay, you are partially correct. Because other than these, when we talk about case control studies and when we talk about cohort studies, okay, cohort studies and case control studies, these both the studies are prospective and sometimes retrospective, but they are called as case control studies are called as backward studies and cohort studies are called as forward studies. Why forward? Because we have exposure with us and we are looking for outcome. Means we have the reason of the disease, but we are waiting or expecting the disease to happen. Understand? That is forward studies, forward direction studies. And backward direction studies is when we have the disease, but we are looking for the cause. We are looking for the cause. Like, let me give you the example so it will, it will be clear in your mind. See, when we are talking about the cohort studies, means the forward direction studies. Forward direction studies. Okay, so what is forward direction studies are? Means suppose that we are, observing a group of smokers. Okay, we are observing a group of smokers for 5 years, and then we are telling within 5 years how many of them developed cancer. You understand? That is forward, means we have the exposure. Exposure here is smoking, and we are looking in the forward direction, and we are looking for, like, if after 3-5 years, how many of them will get the cancer, like severity of the cancer, multiple things will be checked. But this is the major part of the forward direction picture, forward direction studies, right? So we are going in the forward direction, means the population is right here, that does not have anything with prospective or retrospective. That can be prospective, that can be retrospective. Forward studies means when we are going from exposure to, when we are going from exposure to outcome. Outcome. Okay. And similarly, backward is when we have outcome with you and we are going to exposure. Okay. How it will be? You will say, how is that possible? How is that possible? So suppose I am working in the cancer hospital, right? Or I'm working like my own domain is cardiology. I see a lot of heart failure, heart attack patients, right? So I have collected those patients. I have collected the data of those patients, and now I am looking backward, like what have caused heart attack in these patients, what have caused myocardial infarction in these patients. So I'm looking backward for the exposure. What was the exposure? Either, hypertension, diabetes, smoking, alcohol, tobacco. What was the exposure? What was the risk factor? So I'm looking backward. I'm not looking forward. Understand? That is the backward and forward type of directions in the studies. Okay, and backward directions are always case control studies. Forward directions are always cohort studies. I mean, these are the types of study designs. Okay, so these two does not have any connection with retrospective and prospective. Retrospective and prospective is just a data collection type. Okay, data collection type. Data collection type is what? Like, patient is here in the hospital. Okay, so you are going to the patient. Maybe you are not talking to the patient a word, but patient is present in the hospital. Patient is present in the premises, like patient is there and you are collecting the data in front of the present. In front of means not exactly in front of eyes of the patient, but right now the patient's treatment and data collection is going parallelly. Okay, that is called prospective. And if the patient has gone home, died, or whatever has happened, but you are collecting the data from the medical records. Okay, from the medical records, and you are analyzing the data, that is called retrospective. So maybe patient has gone, yes, gone yesterday home, and you are collecting the data today, that is also retrospective, right? And if you are collecting the data today and patient is discharging today evening, that is prospective. Understand? So prospective and retrospective is different. Okay, so in the retrospective, it is not at all necessary, not at all necessary to take the consent form. In the retrospective data type, in the retrospective study type or data collection type, only the ethics approval is important. Understand? Only the ethics approval is important, and that is required. And whoever is saying that it is necessary now for the retrospective, not at all. For the retrospective data collection, there is no need of, there is no need of what? There is no need of consent form, right? There is no need of consent form. But in the cohort studies or the prospective studies, I mean, all type of prospective study, either those are backward, forward, whatever is there, you need consent form. So the answer for this question is no, because retrospective studies does not need to collect the consent form. Understand, guys? Okay. I hope the question is clear now. Okay. Great. Thank you. Yes. Okay. Now, next question to all of you is it important to obtain ethical approval for a case series type of study design? Again, a typical question for all of you, but you have to tell me. Yes, guys, answer. Is it important to obtain ethical approval for a case series type of study design? Do we get the transcripts notes? I will give the PPTs, don't worry. I'll give the PPTs, handouts I'll give. No worries, guys. Yes, guys. Is it important to obtain ethical approval for a case series type of study design? Yes, yes, yes. Oh my God, 100% yeses. But if the answer is no, what do you say, guys? Everyone has answered yes, but the answer is no. How is that possible? Guys, answer. Why and how did you say that you need consent form? Sorry, you need ethical approval for case series type of study design? Justify your answers, because everyone in line said yes. Tell me, guys, why do you need the ethical approval? See, there is a specific class on ethical approvals, okay? But still, let me explain this here. Okay, see, there are multiple types of case study designs, I mean, multiple type of study designs, right? सबसे simple is case report, right? Case report. Number two is like case report or case series. I will write case series here only. Okay. Then case control or cohort, randomized control trial, randomized control trials or any control trials, systematic reviews, right? And then maybe okay, one review paper, simple review paper, simple review paper. Okay, so in these, can you please tell me one by one if we need a ethical approval in case report or case series? No? Okay, because I have written here. Do we need case control or cohort studies ethical approval? Yes. Randomized control trials? Oh, no, 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 no. It is yes. Randomized control trials? Definitely yes. Now, the important part is you have to answer, guys, stop. You have to answer for systematic reviews. If you want to write a systematic review, do you want ethical approval or not? Absolutely no. Review paper? No, right? So now let me describe wow and how it works. Okay, let me describe how it works. So guys, when we are talking about case report, okay, when we are talking about case report, so case report is the study of one person and case series would be the study of more sorry, two or more than two number, any number of the cases up to 10, 15 maximum, up to 10, 15 maximum, right? So let me tell you clearly, for the case series or case report, you don't need ethical approval at all. Why you don't need? Because these are the individual cases. And when you are reporting a case that comes under the rare disease or rare problem or rare combination. Okay, so for that, ethical approval is ethical approval is waived off completely. Okay, ethical approval is waived off for case reports and case series. But what do you need here is compulsorily you need consent form of the patient or patients. Okay, consent form, signed consent form. You need signed informed consent form from the patient if it is a case report or patients if it is a case series. You understand that? So it is very much required to obtain the the consent form, but it is not necessary to take the ethical approval for cases or case series. Okay. Any other studies except case series, you definitely need the ethical approval, right? Now the fourth question is two more questions and then we'll come to the topic. So two more questions. Which sequence of the research cycle is correct? First, identify the problem, literature search, methodology, aims and objectives, data collection. Or identify the problem, literature search, aims and objectives, methodology, data collection. Or maybe identify the problem, methodology, literature research. It doesn't look good. Identify the problem, methodology. Okay. Which one is correct, guys? Two. Okay, two. Four. Somebody is telling four. Hmm. Hmm, 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 hmm. So you are having the right answer. You are telling me the right answer. Sequence of the research cycle is first you have to identify the problem, then you have to search the literature, then aims and objectives, then you have to find or develop the methodology and then data collection. Okay. Now last question is randomized could be the technique of which study design? Randomization is the study design. Sorry, the technique of which study design? Perfect. Clinical trials. Yes, absolutely. Clinical trials. Okay. So now let's come to our first important topic, how to start a research. How to start a research. So guys, this is a layout where we are going to discuss the entire first part. The first 3 days, today, tomorrow, and day after tomorrow. Okay, this is the entire part. But here, do we get the recorded sessions as well? Yes, Neelam, you will get the recorded sessions also. Okay, so my question here is, how do you exactly start the research? This is the theory part. This is like someone has created a flow chart that you have to prepare. You can, understand how to develop the research accordingly. Okay, how to develop the research accordingly. But how exactly you start the research? Can someone give me the idea? How exactly we can start the result? Start the research. Yes, guys. How exactly? What is the first thing comes in your mind when you want to start the research or when you want to come to the research field? Identifying the research gap, fantastic. Identifying the problem, yes, which know something new. Okay. So first thing is identifying the research gap or research problem. That's a fantastic, answer. Yes. First of all, let me tell you. Okay, let me tell you. Current health issues, yes. What are the current problems that are faced and need to be found a solution? Okay, great, perfectly fine. So you are finding a problem. So, first of all, how do you come into the research? Let me tell you. Okay, let me tell you how do you come into the research. So before that, let's start. If we know what we are doing, it wouldn't be the research. Okay, so that's the great Albert Einstein's quote. So, if we are coming up with something new, whether that is negative, it does not mean that, exactly, he doesn't mean that research means something you have no idea. It means that you are going to come up with something new based on the logic, based on the work done, based on the literature, and based on the curiosity. Okay. He meant here is based on the curiosity, based on the work done, based on the, whatever literature and gap, and you are going to do something new. And he also meant here is if it is positive or negative, it doesn't mean that it's not a research. Negative results are also the research. Okay. Negative part of the research is also the research, right? So, yeah. So first thing is, how do you start your research or finding a problem? See, first of all, there are few things people directly say, yes, finding a problem. Yes. So I found basically, see, one is whether either you are the student or researcher, right? Or the academician, or maybe in the industry also. Nowadays, these are the job. Sorry, job of the research, right? Industry also has the research jobs, right? They also conduct the research. But how exactly everyone, come to the same point? Come to the same point. See, everyone, either those are students, maybe students are either brainstorming by themselves, right? Brainstorming by themselves, or getting the idea from the guide. Idea from the guide. What's common here? What's common here? There are two things common. First is idea. Okay. And second is brainstorming. Brainstorming. So whoever is doing, either the student or the academician or researcher, whoever is doing, they are brainstorming to get an idea, right? So they are brainstorming to get an idea, right? To get an idea. So students might be getting the idea sometimes directly as an order to perform the research from the guide, from the mentor, from the teachers, but their guides also have brainstormed to get this idea, right? So, and why they have come to that? Definitely, as the answer says, as you all know, the major part here is first thing that is called as problem. Okay, problem statement. So problem comes from the gap, and gap comes from what? Gap comes from your curiosity. Okay, gap comes from your curiosity, and curiosity comes from where? Either you are studying the papers, books, or in the class you are discussing with someone, discussing with the peers or with the teachers, or maybe you are attending the conference, right? Or maybe it is logical, or maybe you have to do something new, right? You have to do something new, or maybe it is the need, or maybe it is the pandemic, or any kind of natural disaster which be attended right away needs to be attended right away. So there are multiple types of curiosities, okay, which creates the problem. which actually gets you into the problem. Curiosity gets you into the problem. Okay, then you have to find out if it is a problem or not. You have to find out that problem correctly. Okay, suppose I'll give you multiple examples here. When the new problem corona has come in 2020, everyone was clueless, whether those were the public, general public, like the citizens of any country who knows almost nothing about science, or maybe the the Nobel laureates in the science or medicine. Everyone was clueless because they had no idea what's going on and what is going to happen. So what they have come up is, let's study, let's come up with a problem statement. Problem statement is, the first question is, what is this? Right, first question is, what is this, why it is happening, how it is happening. There were a lot of questions. Right. So that is curiosity. Okay. Question also comes from the problem, and problem comes from the curiosity. Okay. Problem comes from the curiosity. So you have to keep yourself curious all the time. Wherever you are studying in the class, ask a lot of questions. If you are reading a question paper, I mean the research paper, or reading the books, always you should ask why it is happening, how it is happening. Okay, I always tell you how to get the question, how to get into a research question, or how to get into a research problem. I always tell you, wherever you are studying, guys, remember these are the basic and very special experiential tips. Okay, whenever you are studying, you are watching something, you should always ask yourself why it is happening, why it is happening, right, why it is happening. Okay, suppose practically I'm telling you, like you will tell, sir, you are talking hypothetically, we don't need such research. I'm telling you the practically. Suppose one person has come to me, sir, I want to do the research in cardiology field, cardiology field, right, isn't it? Or someone has come to me, sir, I want to do in the pharmaceutical analysis, pharmaceutical analysis. Let's take these two, pharmaceutical analysis. Okay, so I will ask, why do you want to do in cardiology? Why do you want to do in cardiology or pharmaceutical analysis? Right? They will tell, sir, I am very much affectionated with heart failure because I cannot see people dying of heart failure. Or there is a problem, or maybe not emotional answer like me, but maybe, sir, this is easy to do, or this has lot of potential, right? Maybe lot of other answers. Why do you want to do? Okay. Then the next question comes is, what you will do, what you will do here, right? Why it is happening, then what you will do here. What you will do means, there are a lot of things in heart failure or pharmaceutical analysis. You have no idea, right? So in heart failure itself, there are three types of heart failure. There are multiple topics in the heart failure. There are complications, there are etiologies, there are pathophysiology, treatments, and prevention, or a lot of things are there, guys, lot of things. So you have to find out, you have to refine it, what you exactly want to do. Okay, and then refine and refine and refine, and then you will come that exact gap is here. What is the exact gap? Maybe your exact gap is, like, I want to compare the sacubitril valsartan, or I want to check the effect of sacubitril valsartan in real time heart failure patient. Okay, so from the heart failure, the big topic, you have come to a very straight away, very short topic, very constructive, very specific topic, like efficacy check or efficacy analysis, or maybe whatever, however you frame the question, but you are going to check the efficacy of sacubitril valsartan, the new drug of the heart failure, right? Or maybe in pharmaceutical analysis, like use of HPLC in new drug development, or whatever, like the new drug development for the targeted therapy of neurodegenerative science or neurodegenerative diseases. Okay, you can come up with anything with your curiosity. Okay, so you have to find out the problem behind problem in the surroundings, problem you can ask the peers, you can discuss with your mentor, you can discuss with your colleagues, you can discuss with your discuss with some experts, you can read in the internet. So until and unless you are not getting the answer to this why and what and how, your question will not be ready. Okay, your gap will not be in your hand, right? So gap, guys, let me tell you, there are multiple types of gap. First, let me tell you how to frame this. Not, this is not the question, but this is how to start your research and how to get the problem. First is, look at the published literature for the inspiration. Definitely seek your research advisor support, sir, how to find the gap or how to brainstorm. Then maybe using digital tools to look for the common subjects or most of the research papers cited, like the excited, we call them exciting topics or trendy topics. Okay, so you can look for the trendy topics in internet, you can check the journal websites, right? You can make your question note and you can then study each and every question to know what question is correct, to understand what question is correct and what question can be done. So like brainstorming can be done before going to anyone, okay, or before starting a research you need, or before finding a gap you need to do a little, not little, a lot of brainstorming by yourself. Okay, now I'll come to the research gap itself. Okay, you might not be knowing, like we will be talking about research gap so much. Okay, so research gap, when we talk about research gap, nowadays we have defined the research gaps also into multiple things. Okay, do you understand, guys? Research gaps are multiple types. So research gap is not just like we don't know the efficacy, we don't know if the drug is drug will work in the patients or drug will work in the population or not. No, there are 100 other things to know. Okay, when we go for a research, we have 100 types of gap. First gap is theoretical gap. Okay, guys, look at this, is very important. Theoretical gap, technical gap, technical gap, procedural gap, procedural gap. Fourth, treatment or management gap, gap. Okay, five is very important. What we say it here, theoretical, practical, evolutionary gap, something is there, I forgot that exactly. There are five types of gap. Okay, so let me tell you one by one. I'll get it. So first is theoretical gap. Theoretical gap means what exactly is the theoretical gap? See, we are talking about a disease, or we are talking about something like that we know the prevalence of heart failure in USA, right? We know the prevalence of rheumatoid arthritis in African continents, right? Or we know what are the things going on, the government policies, or maybe the incidence and prevalences of corona in USA and Canada or maybe Australia. But we do not have that in India, right? We do not have any epidemiological studies of on corona or any disease in India or in our continent, but we have in other continents, right? Or we have those studies in Caucasian population, Caucasian population or Afro American populations, but we did not do any such studies in Indian population, right? So that is called as theoretical gap, right? That kind of things, epidemiological gaps, epidemiological studies, okay, epidemiological differences, these are called as theoretical gaps. Okay, and like whatever, I mean, that's this not only the epidemiological gaps or the prevalence incidences, but which actually comes with certain specific percentages, frequencies. Okay, the description, okay, wherever the term description comes, if there is a difference or if there is a gap in the description of the studies, description of the population, description of the disease or whatever, in two continents, between the countries, between the states, between the cities, between the like international differences, anything is there, that will come under the theoretical gap. Okay, technical gap. Technical gap is what exactly the technical gap is? See, there are two terms, technical gap and procedural gap. Procedural gap is like we have no idea, like how to improve the procedures. Okay, how to improve the procedures means, let me tell you with example. Suppose in heart failure, in heart failure, for the entire, when we have the severe last stage of the heart failure, we go for the heart transplant. Okay, similarly, if the person gets heart attack, if the person gets heart attack, what is the treatment? Everyone, you know that what is the treatment? Usually the patient goes to the hospital, we remove the block and we put the stent there. We put the stents there at the place of heart attack. In the artery, coronary artery, we do the angioplasty and we put the stent there, right? That is the procedure, right? The normal procedure. But before 10 years, not now, 10 years before, how they used to do is, that is called as thrombus aspiration. They just used to remove the thrombus, used to remove the block, and that time there were the bare metal stents. Bare metal stents, BMS, we used to call them, bare metal stents. Now in the 10 years or 15 years, the revolution has come in the field of, medical devices. And now, right now, we have the stents which are called as DES, drug eluting stents. So this is not just the bare metal which we are putting in the artery, but we have the metal with the drug, slow releasing drug, right? So that is even helping the artery, to prevent the further blocks, right? And after that, now even we have the absorbable stent. So the entire stent in 4 5 years, it will be absorbed in your artery itself. That's not it. That is not even the bare metal. That is the biodegradable elements, biodegradable, material which will be absorbed in your artery. Okay, there is the procedural gap. Okay, and the another part I'll tell you, procedural gap. This is not only about the device, but the procedure is, previously we had no idea like how to check the calcification inside the artery, how to look inside the artery. We just used to do the angiogram or CT scan, and when we used to find out where exactly the block is, we used to remove it. But now we have OCS, we have multiple techniques, so we can even, keep the catheter inside the artery that will tell us how much percentage is the calcification. Okay, how much big the lesion is, how thick is the lesion is, how hard is the lesion is, what is the, it tells us about the scorings itself. So the procedural gap means, like, whatever has done somewhere else, whatever is not done at your place, whatever you can do, or whatever developments can be done. You understand? Whatever developments can be done. So definitely your curiosity, like I always think like there's a disease called pulmonary artery hypertension. I always think, see, that disease is not curable at all. Okay, disease is not curable. We have the symptomatic treatments, we have the drugs to cut down the pulmonary artery hypertension to make it normal. It doesn't go to normal anyways, but we have the multiple things. But we have no treatments for PH. Treatment means we have no drugs which can reverse the pH, which can reverse the pH. So that is a procedural gap. We don't have anything, any drug or procedure which can reverse the pH. So research can be done in that side, procedural gap. Even when like suppose, again, very simple example I'll give you, while I can give you hundreds of examples here. Like, you want to collect the data. You want to collect the data in what form? You want to collect the data in Excel sheet. But you can collect that same data in the, you can collect the data in the paper, but there is another methods. You can collect the data in Excel sheet, right? Directly in the computer, and you can analyze that. But the better thing is, you can collect that data in a Google form, which will exactly make you the Excel sheet accordingly, and similarly to all the patients, all the subjects. Okay, and you can take the help of AI to analyze your data. So that is also technical and procedural gap. Okay, like you are enhancing the speed, you are enhancing the efficacy, you are saving the time with the help of technology or any kind of things, and you are increasing the performance, you are enhancing the performance of any procedure and getting into the positive outcomes, right? So that kind of research gaps are called as technical or procedural gap. right? The treatment or management gaps, definitely when we look for the clinical trials, any phase of the clinical trial, or anything which comes under the treatment part or the management part, prevention part, either dietary, or maybe the food items, or maybe the nutraceuticals, or the medicines, everything comes under the treatment or management gap. Okay, so there are different types of gap nowadays, different types of gaps nowadays. You have to, now I saw our new protocol of Manipal, and I was shocked. You just don't have to write the research gap, you have to write the different research gaps on your topic. What is the theoretical gap of your topic? What is the treatment gap of your topic? What is the procedural gap of your topic? Everything you have to mention, then only the ethics committee will pass your protocol. Okay, so you have to come up with the problem and the gap, first of all, with the curiosity. That's how you start your research. Then, as I told you, points to consider before developing a research question. Now you have the curious mind, you got the research problem or research gap. You have to create it into a question. You have to create a question out of that. Exact question out of that, because see, research problem cannot be solved directly. First, it should be an aim. Okay, it should be a question, it should be a valid topic. So topics are not just created like you created a problem, you come up with a problem, and this will be fourth was the treatment gap. Fifth, I don't know, I'll get it and I'll find it. That was evolutionary gap something. I'm not sure what exactly, I forgot the term for that. Okay, but that was related to what kind of future aspects you can think of your research or think in the research. Okay, that was kind of future perspective. Okay, evidence gap. Yes, evidence gap. Exactly, Prasanti. That was evidence gap. Okay, so now thing is, after that, you have to, think, as I told you, why, how, who is doing, what extent, when can be done. So these are the things when you create your problem into a research question. Okay, when you are creating or transforming your question, okay, so we are, transforming our problem into the research question. Okay, research question. See, research question can be any subject. See, I am from the medical background right now, right? So I can tell you the medical background subject, clinical, examples. So it is not like only for clinical example. If you are from the technical side, if you're from the, nursing side, if you're from the biotech, if you're from the genetics, you can just correlate. This is the simple process. This is the only process. So first you find out the problem, then you transform the problem into the research question. So who, how you will find out the research question, how you will create the problem into the research question. So whenever you get the problem, like, okay, I have to solve this problem, I have to find out what are the risk factors for heart attack. Simple, right? What are the risk factors for heart attack? So what will come now, like what are the risk factors of heart attack, how you will develop a question out of it, how do you will develop a research out of it. So first of all, you have to think of in whom you have to do this study, right? Who means participation. Okay, participation or participants. So which specific group you will take? Heart attack patients, MI patients, which MI you will take? Either, maybe you will take the ST elevation MI, non-ST elevation MI, stable angina, unstable angina. What kind of specific group you will take? You will take only males, females, or, all the genders. What kind of genders you will take? What is the age capacity? What will be the age thing? You will be taking only kids, adults, or the elderly people. What ethnicity? South Asian, Asian, Indian, South Indian, North Indian, or, Caucasian, African, Afro-American, Indo-Americans, or whatever, Japanese. That your ethnicity would be defined clearly. Okay, the key figures, socioeconomic status. Key figures means the demographics and all. Socioeconomic status means like what is the, average income, the education, the occupation. Those things comes under the socio-economic status. Like it depends in each research question, that kind of each in the clinical research, each clinical research question must have these things. See, Suppose I'm asking you, like, can you, do a KAP study, knowledge, aptitude, and practice studies, in the for the use of insulin. So definitely there is a difference. If I am asking, someone who is not educated, I'm asking how to use the insulin pen, they will not know. Okay, if I ask them, what is diabetes, they will not know what is diabetes. They'll just simply tell something. Okay, if I ask a graduate what is diabetes, he can give the correct answer, or he may give the some technical aspects also of the diabetes, right? So socioeconomic statuses are very, very important to study in the clinical research, right? And to what extent, what are the issues, like what are the problems, you can list down your problems. And then, is there any unanswered questions? Like, see, I was asking what are the risk factors for heart attack, right? So you will see that, okay, literature says smoking is the risk factor for heart attack. Drinking alcohol is the heart attack, risk factor for heart attack. Hypertension, diabetes, these are the risk factors for heart attack, right? These are the risk factors for heart attack. But how exactly these are connected? How much these are connected? How significantly these are connected? Okay, in what population exactly these are connected? If the, smoking for 1 year is connected, smoking for 5 years is connected, 10 years is connecting. So you have to find out, in the literature everything is given now. I mean, right now literature says that, alcohol and smoking and tobacco chewing and hypertension, diabetes, high dyslipidemia are the major risk factors for cardiac problems, major risk factors for heart attacks. But if you want to do it more, like what are the unanswered questions, you can go more. If the what amount of alcohol, what amount of smoking, those things, those kind of questions can be written in a line, written, and then can be checked. So you can check the topics, subtopics, you can check and refine the questions. You can refine the questions, like, okay, what are the treatment patterns for any disease? Like, suppose someone is getting fever, right? Someone is getting fever. So how would you evaluate the fever, right? How would you evaluate the fever? You are doing a research on the fever. So how would you evaluate the fever? What kind of fever it was? It was a viral fever, bacterial fever. In bacteria also, gram positive bacteria, gram negative bacteria. In viral fever also, which viral fever it was. So you have a lot of things, which drugs was given, which drug would be given. Lot of things are there. So you have to refine everything, you have to define everything. Okay, so then you have to check when, who, in whom we will do it, to what extent we can do it, and when we can do it. Is this a current problem? Is this related to the specific period of time? Whenever, like, it is past also, like, okay, there was the, you guys might not be aware, there are many, H1N1 waves in India. Almost every year H1N1 waves, come in India, in different parts of India, right? H1N1 means the flu waves, right? So at what time, in which area it was? So you have to do at that time, what was the risk factor, how it has affected, how much it has affected. So those things, like when, is very important. Okay, the timelines and the timings and the specific period of time is very, very important here, and the importance of the issue is also important here. So again, where it has been done, as I'm telling, where also is very important, because geographical patterns, geographical characters, and geographical factors always affect the disease. Like, if I talk about the Kochi has, one of the India's very famous city to have the canal transportation, right? Canal transportation. There are the water transportation system. Okay, so because of the water transportation system, there are the problems of in the sanitation. There are the mosquitoes, and those mosquitoes are having the problems, creating the problems. So the waterborne diseases are having high prevalence in Kochi. Okay, that we can say, like, because that is the location or geographical conditions. If I say that I want to do the study in Ladakh, so they'll be like, okay, there's all the time there is cold, okay, ice. So maybe the infections, chances of infections, chances of cold, those things are always there. Okay, so in the different regions, like how you are doing in the developing states, or in the slums, or in the village, or in the cities, so everywhere the geographical things are different, whether that is in America versus India, or America, or India versus Australia. So geographical conditions are different, food patterns are different, our physiology is different. So these all things are very, very important to think when we are going to do a research, right? So these all things would be, are very important to think and very important to discuss. Then why this issue is interesting, why we should do this study? Everything is correct, everything is looking fantastic, but again, why we should do this study? Is it impactful? Is it impactful? Okay, is it impactful? See, there are a lot of trendy topics, there are a lot of trendy research topics, and a lot of things are there to do. But if these are really impactful, okay, that is the question. If this is really impactful, suppose I want to do like, I want to do if the metformin is useful in diabetes. If the metformin is useful in diabetes, that is a research. I can, spend million of dollars, in recruiting the patient, giving the metformin, checking out the patients for years, following up for the years and years, right? And then I'll find out, okay, oh yes, metformin is reducing the HbA1c. Metformin is helping reducing the blood sugars, fasting blood sugars, or ppbs. But is it impactful right now? Not at all, because the research has been done already. So there are multiple factors which stops us doing such researches which are not impactful, which are wastage of time, which are wastage of money, wastage of resources. So always find out if your research is impactful or not. Okay, so before developing a research question, developing a research question means you are starting the research. Okay, when you have the question in your hand, that means you are going to start the research. So this is the pre-research time. This is the pre-research preparations. Pre-research preparations means finding the problem, finding the gap, and based on that, you are thinking about where to be done, like when to be done, and in whom it would be done. And first and last question is why we are doing it, right? So this is the important things you should understand, you must know, and that's how you should start your research. Now, the thing is, research question must be, okay, how must be the research question? Okay, what should be the research question and what are the major characteristics of the research question? See, you have problem in your hand. So let's see what you have learned till now. Problem you have, gap you have, right? Now you have all these things, all the things you have studies. I mean, you have done the market research. I'll say it, market research, like whom in done, what participation, what participants, and how it will be done. So market research is done now. Market research is done. You have to come up with a question now. The next thing is question. How should be the question? How should be the question? So question should have some qualities. Okay, guys, questions should have some qualities. First of all, it should be specific. The question, the research question, it should be specific. Okay, what is specific? Like there should be no fishing expedition. The good question is usually crisp and concise. The good question is always crisp and concise. I was giving you the example. Let me give you another example. Let me give you another example. Okay, simple. Let's take any disease. Any disease. Let me take the diabetes itself. Okay, you want to do, a student comes to me, a student of mine comes to me, sir, I want to do the research in diabetes mellitus. Is it specific? Is this a specific question? Not at all. This is not at all specific. Guys, focus. This is not at all specific. I told what in diabetes, yeah. What you want to do in diabetes? Diabetes has multiple types. T1 diabetes, T2 diabetes, GDM, GDM, drug-induced diabetes. Okay, and we have LADA, we have MODI. So we have lot of things. Okay, in that only we have adults diabetes, we have youngsters diabetes, which we usually call at CAT DM. Okay, we have pediatric diabetes, we call it usually the diabetes in children, young diabetes. Okay, we call it young diabetes. So this also comes in young diabetes only. CAT2DM is nothing but child and adolescent diabetes mellitus. Okay, adolescent diabetes mellitus or diabetes mellitus in child and adolescents. Okay, so guys, this is just the stratification of the topic. Okay, we are going to concise it. We cannot do the study in diabetes right now because diabetes is a very vast topic. Okay, so first we take a vast topic. Okay, vast topic, or we call it subject, right? If someone wants to do, I'm trying to do in this nephrology, vast topic, subject, then come up with a specific topic, or topic like in this I want to do in diabetes type 1, right? Type 1 diabetes specific. Okay, in diabetes I want to do in type 1 diabetes. Then what exactly type 1 diabetes? What do you want to do in type 1 diabetes? Because there is the clinical characteristics, there is epidemiology, there is diagnosis, there is treatment, there is prevention, management, there is complications. In what exactly you want to do the diabetes? Either in the clinical characteristics, epidemiology, diagnosis, this. So in the specific topic also there are subtopics. Again, stratification. Okay, here also, if I want to do in diagnosis, right? So in diagnostic also, guys, in diagnostic also there are like biochem biomarkers, okay, tissue biomarkers, genetic biomarkers. In which biomarkers you want to do the study? So you have to come to the specific, very concise and crisp topic. Okay, you cannot go ahead with a vast topic. Okay, you cannot go ahead with a vast topic. And who will do this? Only you can do this, no one else. I cannot help, and I did not help many of my students just because of this. They came up with the very enthusiast, like, sir, I want to do the research in cardiology. Today also someone messaged me, sir, I want to do the research in cardiovascular diseases. Can you please give me the topic? I told, what's your specific interest in that? I just simply asked one question, did not answer yet. He did not reply yet. How I am nothing to answer to your question, because first you have to be specific. In that specific also, then we will search the literature. We'll find out in diagnostic what is new, what is trendy, what's not happened, what has happened. Then we will come up with a question. Then only we can come up with a question. Questions will not come from the, with the rain. You have to brainstorm for a good question. Okay, so first thing in the research question framing is specific. It should be specific. Then measurable. It should be measurable. Measurable means testable. It should be purposeful and statistically good. Statistically measurable. Okay, so it will give us the potential results. It will give us the potential outcomes. How? Like, okay, we are looking for at least this much change. Hypothesis, this much change in the outcome, this much change in the treatment pattern, this much change in the epidemiological things. Okay, and we have the sample size. So measurable, it should be testable, statistically testable. Okay, then attainable. Attainable means we have all the resources and expertise in our hospital, in our center, in our research center, in our college to do this study. Feasibility check. Okay, this is the feasibility check. We should not go beyond our resources. If we don't have the resources, how will you perform the research? So research question must be attainable, means you have the expertise, equipment, and resources to tackle it. You understand? So this entire thing is called as smart research question. Smart research question. Specific, measurable, attainable, realistic, timely, and important. So realistic is something you can do. The good question is relevant. The good question here is relevant. Then timely, it should be done in the time frame. You should not take something which can be, which cannot be done within the time frame. Your study is for 6 months, but you have the research question which cannot be done in the 6 month, which takes 2 years or 1.5 years. or maybe which can be done in 1 month. Both the side of the coin are not good at all. Okay, so you have to be very specific, like, okay, this much sample size, this much activities I can do in 6 months, I can do in 3 years, I can do in 1 year, whatever timelines are there. So the reasonable time frame should be there, and your question should be completed, or your research related to your question should be completed within time. Important means, as I told you, if the research is meaningful, whether it is negative or positive, it really doesn't matter. Okay, it really doesn't matter whether it is positive or negative outcome. It doesn't matter whether your experiment is failed or passed. It doesn't matter. It should be meaningful. Failure or success is not counted here. It is just that you did something meaningful. So you know the procedure and you know the failures. Okay, so that is how you define your question. Everything should be in this question. So these are, okay, guys, see, this is just how your question should be. Okay, this is just how your question should be. This is called as smart practices. Okay, smart practices for the research question. But what this is like, again, let me tell you, this is how your question should be. Okay, how your question should be smart. But what your question should be, it is here. What your question should be is here. Formulating the research question is, it should follow some specific guidelines. If you are working on a clinical site, clinical thing, the PICO is for the clinical purpose only. Okay, PICO is for the clinical pharmacy, clinical students, pharmacy students, and nursing students, biotech students. I mean, if you are working in the clinical side, PICO is the formulation guidelines for your research question. Your research question should include the P, I, C, and O. P stands for patient, population, and problem. I stands for intervention. C stands for comparison. O stands for outcome. There is one more thing called S. S stands for study design, because study design. Okay, let me tell you how. See, when you are framing a question, it should reflect what kind of population and what kind of patient you are going to take it. Okay, what kind of problem you are going to take it. I'll frame the question for you. I have the realistic examples here. Then you should know what kind of intervention or what kind of prognostic factor or exposure you are showing here. Okay, what kind of exposures you are showing here. So that exposure could be either the drug intervention, could be the stunt procedure, counseling, whatever, the interventions, right? Interventions could be anything, whether it is a drug intervention, whether it is a suggestion intervention, whether it is yoga, whether it is, any kind of telemedicine, whether it is, I mean, whatever extra you are giving with the hospital protocol, with the treatment protocol, with the guidelines. Okay, along with guidelines, whatever extra you are putting in the treatment pattern is intervention. Okay, whether that is a tablet, capsule, extract, or that can be even suggestion, that can be exercise, that can be telemedicine, that can be reminding the patient again and again for the yoga or for the tablet taking. So those all things comes under the intervention. Okay, then comparison. How you are comparing, like you are comparing drug A versus drug B, or drug versus placebo in control trials. Okay, or maybe you are comparing what? You are comparing guidelines, medical therapy, whatever clinical therapy is going on with the new drug. Or maybe you are comparing the healthy people with the diseased people. Okay, healthy people with the disease group. Okay, case group and control group. So comparison must be there. And then outcome, what exactly you are looking for. Maybe you are looking for efficacy, you are looking for, effect of the drug, you are looking for effect of the procedure, whatever you are looking for, something, whatever you're looking for, prevalence, whatever you are looking for, it should be under the outcome. And everything will be following a study design, whether the cohort studies, case control studies, randomized control trial, non-randomized control trial, whatever. Okay, so this will go with study design. So the entire process is called as PICOS guidelines for formulating the research question. Okay, so now let me tell you with the examples. Suppose, like assessing. Okay, You will be writing the um, assessing the health related quality of life. Okay, assessing the health related quality of life in arthritis patients. Arthritis patients in a tertiary care center. Tertiary care center after muscular exercises. Okay, in rural, uh, rural Karnataka. Okay, this is the question. This is a simple question. Like assessing the HQRL in arthritis patient in a tertiary care center after muscular exercises in rural Karnataka. So what exactly this is showing? See, if you look at this, it has everything. First is patient or population and problem. Who is the patient? Arthritis. Okay. Who is the patient here? Guys, who is the patient here? Arthritis patient is the population. Problem is arthritis. Understand? Problem is arthritis and the population is arthritis patients. Right? Intervention. Intervention is muscular exercises. Intervention is muscular exercises. Exposure is muscular exercises here. Comparison is what? Comparison which will be, definitely comparison will be the people who are taking muscular exercises versus who are not taking muscular exercises. It is not necessary to write here like versus, okay, but that is obvious. The person who is taking muscular exercises versus non-muscular exercises will be taken, okay. And then outcome is HQRL, assessment of health related quality of life. Health related quality of life. And population is like in the tertiary care center, rural Karnataka is location. So your research question is having everything, okay. Research question is having everything. So there is a little exercises to my audience right now. There is a little exercises. Can you write one question for me, including all PICOs, including all PICO, PICO, including all PICO? Can you write me one question, guys? You have 2 minutes, 3 minutes. Think of and write a question. This is a little exercise for all of you. Yes. Today I'll be talking about the feasibility in bonus. Yes, guys. You have 2 minutes to write the question. Please come up with a question. Can you repeat the question? You have to prepare the question, Mohit. Prepare a question, research question, including all PICO. Assessment of HQRL in patients taking immunotherapy. Sadia, question is not complete. No, question is not complete. Okay. You have to be, you left few things. See, HQRL could be your outcome. Your patient will be immunotherapy taking patients. What immunotherapy? For which disease? What disease? What type of population? You had not written the population here. In which disease? Immunotherapy could be for, HIV, immunotherapy could be in SLE, immunotherapy could be in rheumatic arthritis, in corona, immunotherapy in the cancer patients. A lot of things is there. So your question is just not complete question. Determining the effect of oral sunscreen in South Indians. I didn't understand this. Targeting Parkinson's via nose delivery. Okay. in animals, in humans, how you are doing it, or through the Schrodinger you are preparing, you are developing the drug. What exactly, Lalita? I didn't understand. Sri Lalita. Questions should be complete. Your questions are not complete, guys. Okay. You should have the complete question where you are including everything. Your population could be animal also, not only the human beings. That's why I'm telling these classes are for everyone. Population could be your animal studies also. Okay. What is the intervention? Research to assess the knowledge, aptitude, and practical. Okay, practice regarding prevention of diabetes, foot ulcer, and diabetic patients in a primary care center. Perfectly fine. I think this is a good question. Knowledge, aptitude, practice. Okay. Prevention of diabetes. Okay. And foot ulcer patients, diabetic patient is your population. Intervention is knowing their, knowledge, aptitude, attitude and practice. Prevention is your outcome. And you have your comparison also. Okay. This is your observational study, so no need to compare here. You can compare in between the groups. Quality of life status of stroke patients in young adults. Like quality of life status of stroke patients in young adults. Stroke patients in young adults where incidence of these are the topics of whatever Teja Mala you have written, M Teja Mala. This is a question. This could be a title of the review paper, but this cannot be a title of the original study because original study should be having all these things. Incidence of anxiety in postmenopausal women in India. Incidence of anxiety in postmenopausal women in India. Okay, what could be the PCOS here? You have written correct, but what could be the PCOS here? Assessment of risk factors of clinical characteristics and outcomes in pancreatic. Okay. Cross-sectional studies on prevalence of metabolic syndrome in asthmatic patients. Okay. To evaluate the anti-hyperlipidemic effect of consumption in chia seeds in obese patients. To evaluate the effect. Okay. Outcome consumption of chia seed is intervention. Obese patients is a population. Anti-hyperlipidemic. Okay. Perfect. To synthesize and evaluate novel derivatives as antibacterial agent. Okay. Okay. Do pain diaries work in pain management for cancer patient? Hmm. In adults with type 2 diabetes mellitus, does the administration of drug X lead to high incidence of heterotoxicity and redotoxicity? Okay. You tried really good, guys. Assay of nephritis who are drinking underground water in Vadodara. Yes. Why not? See, so many topics have come here, guys. See, you have no idea how nicely you have come. A little exercise have come up with a lot of brainstorming and hundreds of the topics. Almost 30 topics I can see here, guys. Come on. Wonderful. Appreciating. Okay. This is really appreciable, guys. Wonderful. Fantastic. Nice question. So that's how you create your questions. Okay, right now, whatever has come in your mind, you have put it in that, right? But before framing the question, you have to check the feasibility. And how you will check the feasibility? You will check the feasibility by checking why, who, where, how, everything. Okay. And how much funds you are needing, what are the resources do you have? So those everything you have to keep in mind before framing the question paper. Not the question paper, framing the research questions, right? Whatever things like PICO and this specific measurable attainable, like you should have the expertise, equipment, resources. This could be done in the reasonable time. So everything you should keep in mind, and then you should make your research question. Okay. So I hope you guys know about research question development now. I hope you guys can construct the research question. Is it okay, guys? Research question formulation. You understood? Understood? If you have any questions, please ask me now. Okay. I hope you've done how to come up with the research question. That is our first task for today. You understood? Okay. Fantastic, guys. Fantastic. Thank you. Thank you. Okay. Now, the next question is, team building and its advantages. Guys, when I'm talking about team building, can someone tell me what exactly is the team building in the research? What exactly is the team building in the research? Can someone tell me? Yes. Suppose I'm writing here, A is the researcher here. A is the researcher here. And A's designation is right now, suppose a PhD student. PhD student. Okay. A is a PhD student and researcher here right now. So what and how he will do the team building? What would be the team for him? Corresponding author, statistician, researcher, guide, okay. Person with different domains, gives the take information colleague or information guide and seniors. Okay. Okay. So team building is, first of all, team building means what? See, team building is always done according to your research question, aims and objectives. Okay. Duration and size of the study. Size of the study. Okay. Size of the study, right? So how do you do that? How do you understand that? Let me take you one example here. Okay. Let me take one example so you can easily understand that. Okay. Let me take one example here. Suppose A is the researcher. He is doing a study on like correct, right, guys? Assessment of diagnostic patterns of diabetes type 1 in youngsters, right? So he wants to do the research on this, right? See, this is a major, this is the normal pattern. What you guys are saying that you need a guide, he need a guide, maybe one co-guide. He may need some experts, experts like a statistician. This is the normal team. Okay. This is the normal team. But what exactly the team building here is, he cannot do the entire research. When I'm talking about diagnostic patterns, diagnosis for diabetes comes like it needs the X-ray, maybe the ECG or echo, but let it be. I mean, let's not talk about the ECG echo here, because why I'm not talking about the ECG echo is because it will be comprehensive otherwise. Okay, wait. Let's not talk about ECG. Let's not talk about X-ray also. Simple, make it simple. I'll make it very simple. See, so first thing what he needs is, he needs someone from biochemistry who can perform GlyHB, FBS, PPBS, all biomarkers, right? All biochemistry biomarkers. Someone who can do all biochemistry biomarkers is here. Then he may need a genetician, genetics expert who can do the genetic sequencing to differentiate between type 1 diabetes and type 2 diabetes, mellitus, LADA, and MODY. These are the young diabetes. So who will differentiate for us? We may need one person from genetics. Okay. We may need one person from genetics who can help us. we may need someone, we may need someone from other departments like ophthalmology to check the complications, cardiology to check the complication, nephrology to check the complication, neurologist to check the combination, to check the complications in the kids. Okay. And a general physician to treat the ketoacidosis if the patient develops the ketoacidosis or comes with the ketoacidosis. Okay. If you are framing a good research question, if you are framing a good research, you need multiple stakeholders. Okay. Everything cannot be done by you. Okay. Everything cannot be done by you. So the basic and advanced team building is important. Basic team building is you need a guide, the mentor. Okay. You need some co-guides or subject experts like a statistician or the expert of the specific topic or subject. Like physician, you can take in the experts here. But when you are doing the genetic testing, biochemistry testing, or you need someone to take the complications, maybe the physician or something, you need specific stakeholders and you must take them. Okay. You must take them. This is about the human being. Okay. This is about the resource persons. What I'm talking here is this is only about the resource persons. But team building is not only limited to resource persons. Team building is also the resources. Okay. Like the A is doing the research in XYZ hospital. But XYZ hospital do not have the genetic sequencing facility. Right? So what he will do is he will approach a research center or the hospital or the another center, SXX, kuch bhi, whatever, and they will collaborate and he will invite them to participate in the research as a collaborator or as a team. Okay. The A will do MOU, memorandum of understanding, with that team, with the resources or with the facility, with the research center, with the college, and then they will do the research, they will perform the research. Okay. That is also comes under the team building. Okay. That is also comes under the team building. So team building is not just about that you have guide, co-guide and all. I'm talking about definitely high intense research. I'm talking about the PhD research and high topic. This is not definitely for, the UG students. This is not for the PharmD students, because they can do with one guide, one or two friends, they can collect the data and do this. But what I'm talking is very necessary when you are a big researcher, when you are good in research and when you are doing the research for longer time and when you want to do a multidisciplinary research. Research is always multidisciplinary. Okay. Research is always multidisciplinary. It is not a one person. It is not a one person or one man army. Okay. This is not a one man army job. You need the team. You need the team. Okay. Now I'll come to the disadvantage and advantage. See, first of all, the researcher should not be greedy. They should not think that all the funds I will only take, all the credit I will only take. That doesn't work at all. Okay. This does not work at all. You should not be greedy. The researcher should not be greedy. Then the second very important thing is how it is important and what advantage it has is, see, when you have the collaborators, it shows your network strength. Guys, note down it, network strength. So if you are applying for the grants or something, you are publishing the paper, if it has 4 top colleges name as affiliation, you will get it published, you will get the grant faster than anyone else. Okay, because it is showing your network strength. The team building is very important because it is showing the network strength. Understand? And it is showing the expertise. It is showing that you are not doing everything. There are experts for special things, like for genetics, there is a genetician. For the, like for the radiology, like for the CT scan or something, there is a radiologist. For the cardiac complications, there is a cardiologist. Okay. And for animal studies, there is a person who is from pharmacology. So you need a good team. There are the experts. And if you're showing the experts and good collaborations, it is easy to grab the grants. It is easy to get the grants also. Okay. So these are the important things in the research, guys. Should not go all alone. Okay. So I think these were the topics for today to discuss. Now we can, discuss the questions. You can, fire the questions to me, and I will be happy to answer. Yes, if you have the questions, guys, tomorrow I'll be taking protocol writing and ethical considerations, important, and some live exercises and assignments, guys. Okay. So yes, now over to the questions. Yes, guys. Students cannot publish research paper. Who told Kailash Patil students cannot publish the research paper? Tell me. Who cannot? Yeah, of course, students can publish the research paper. They can publish the research paper. Come on. Please explain because again. Okay, I will. Okay. How to get Google form? You want me to tell you how to prepare the Google form? Guys, come on. Abu Bakar, okay, how to get Google form is nothing. You have to prepare the Google form. I'll tell you the Google form preparations. So you just in the Google, okay, let me show you. That would be great. Okay, let me show you once. Let me show you once. How to prepare the Google. Very basic, but very important question, guys. Very important question, I believe. So where is this? Yes. Okay. I hope you can see this. You can write the questions, guys, by the time. Just type here Google form. Okay. Google form create. So you will see a lot of things. Form creation. Okay. There are a lot of things. So, you can just go to the Google form creation, type Google form, create form. Okay. So this in the Google Drive, whatever you are logged in with, it will come like this. Okay. I want to do suppose KP study on diabetes. Okay, KP study on diabetes. It has already come here. You can write the description of the study. Then what type of things you want to collect from the patient? Like suppose first thing you want to collect the patient name. Okay, patient name. Then the next question plus here plus means it will add the question. It will create the sections. You can add the title or description here. You can add the picture here. You can add the video here. You can add the sections again here. Okay, you can import the questions from this arrow mark. Okay, so like first you will ask the patient name, then you will ask the age of the patient, and then you will ask the, suppose you want to ask the if the person is smoking or not. So you just have to choose like smoking, if the patient is doing, like yes or no. Okay, so yes or no is the answer. So he will choose between yes and no. And if you want to, like suppose I'm telling you multiple things, if like you want to know the qualification of the patient. Okay, qualification of the patient. What's the qualification? So qualification, either you can write directly, you can ask them to write directly, or you can write like primary school, secondary, or higher secondary, you know, higher secondary, graduation, or so on. Okay, graduation, so on. You can add a section. This is the demographics. You can add the about the treatment part. Okay, like you want to know about the treatment part, treatment part or symptoms part. So you can just ask them if they are taking metformin. If you are taking metformin, okay, so they will answer directly. Okay, answer directly, metformin. Yes, yes, or no. Okay, no. And if you want like what dose you are taking, so you just have to write dose of metformin. Okay, dose of metformin. Change the question type. There are multiple types of questions: short answer, big answer, multiple choices, multiple checkbox, drop down, linear scale. So like short answer, I want to write dose of the metformin 10, I mean the 500 mg, 1000 mg, 1500 mg. So similarly, you can prepare the Google form, and that Google form will come into the Excel sheet directly. Okay, that Google form will come into the Excel sheet directly, Abu Bakar. Okay. Okay, now I have to explain the because then I am about to write review article. I have gathered research articles. I am stuck now how to start. We'll tell in 1 or 2 days it will come. Okay, we'll be talking about the review articles, writing the review articles and all. Okay, so don't worry. I think those can be taken soon. Is it important to always have an affiliation while publishing any research? It is important. Actually, it is important. See, without affiliation, if you are, see, anyways, you will be studying somewhere or working somewhere, or if you are an independent, you can write the independent, no problem at all. But definitely you will be working with someone. So it is better always to keep the affiliations. Okay. When you are publishing as a news, you don't need affiliation. Okay. You are publishing, but if you are publishing as a researcher, you must have an affiliation. Okay, it is very important. If you're a pass out student, you can keep the affiliation of your old school or your company, wherever you are working, that organization. But affiliation gives the validation. Okay, why affiliation is important, Dr. Nancy, is because affiliation gives the validation. Difference between prospective and retrospective, I think I have told many times, but see, again, I'll tell you, retrospective means when you are collecting the data from the medical records only, but in absence of the patient. Absence of the patient means patients is not getting treatment parallelly being in the hospital. Suppose like patient is in the hospital and you are collecting the data right now, that is called as prospective. But if the patient is discharged or dead and you are collecting the data from the medical records, that is called as retrospective. Maybe you are collecting the data in front of patient in the hospital when the patient is in the hospital. Maybe you are collecting the data 100% from the medical records, but that is called prospective. And if you are collecting the data in absence of the patient, that is called as retrospective. Absence means not like the patient is in the hospital, but he has gone for MRI and you are collecting the data from, the medical record. That is not retrospective. That is prospective. That means when the patient is out of the hospital after discharge or death, and you are collecting the data from the medical record, that is prospective. I mean, sorry, that is retrospective. Understand? Very simple. There is nothing to take with the past events backward, forward direction. This is very simple phenomena. If you are collecting the data in presence of the patient in the hospital, that is prospective. Okay. Where you can interact or do not interact, that's up to you totally. It is necessary to have a guide while doing a research. If you are a student, it is mandatory. Yes, it is mandatory. So it is necessary to have ethical committee approval if someone is doing survey studies. Yes, wherever you are involving a human being, you need the ethics committee approval, whether those are surveys or whatever. Surveys also you are involving the human beings and their information. It is important. Sir, if we do the research on anti-ulcer activities of particular herbal extract, but it's already done and published in Google Scholar, can we proceed using other screening models? You can definitely, Spurti, you can do that. As a family intern, can I take both first author and corresponding author? It is totally up to you, but better if you distribute your authorship. If you are a first author, give corresponding author to someone else, because both the authorships, corresponding and first authorship, guys, listen to me carefully. Both the first and corresponding authorship has equal credits, has equal power. So never keep it with you. It will not double your power, or it will not give you the double credits, not at all. Okay. So always distribute, always contribute to someone else's also. So they get the equivalent support. They get the equivalent credits. Okay. So never be the first and corresponding author by yourself. Give it to someone. So that's perfectly fine. How to get different sector persons like my study related to medical person for research related studies? You can simply approach them with a humble nature. Sir, if anyone wants to find research papers for himself, then please tell me a website or link. No, 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 no. Go to the Google, keep the title, read the title. If it is important for you, then click on the title. If it is a valid website means there are the websites of the journals, or go to the specific journals of that subject. Like if you want to search for the biochemistry, go to the biochemistry journal. If you want to search for the cardiology, go to the cardiology journal. Okay, so search for the journal, search from the journals, Google Scholar, PubMed. There are multiple things, Web of Science, there is Scopus. Go there and search the research papers. Okay, or Cochrane Library and all. So can you give me some tips? I will definitely. This question will be taking in the next classes. Sir, how do we know that we have covered the literature and the question is actually a research gap? How do we miss on literature? I didn't understand this, Akshita. If you can wait, let me allow you guys to speak first. I think that will help me also. If you can speak or write again, Akshita, that will be perfectly fine. Okay, feedback form. Feedback form, guys. Can someone share the feedback form? How to write a review article? I will tell Sirin. I will tell in the next classes. Can we approach hospitals for data collection if we want? If yes, what is the procedure for that? See, if you are, there is a different procedures. Okay, to approach the hospitals. First of all, if you're a family student, you are posted there. If you're not posted there, you can go and you can approach the doctors. Simply, you can approach the doctors with your guide or without guide. Sir, I'm interested in this research. I am affiliated to this college, and kindly please help us doing this research. And we are very interested, and we will be helping hands to you. You will be getting the credits equally in the research, in the publications. So you can simply go and approach with the humble nature. Okay, you can simply approach with the humble nature, and no one says no, literally. If they get the credits, if they get the credits of the work. So but you have to go with the procedure. First, go and talk to the doctor. If they give permission, write the protocol, submit to the ethics approval, and once the approval is ready, then conduct the research there. Okay, you cannot do it directly, but first take the permissions from the doctors, from the department head, from the dean of the college, and then you can go with the similar procedure, like writing the protocol, coming up with the questions, and then taking the ethical approval, and then doing the research. Okay, what if we are in the middle of research and someone has already published similar results? What to do? You can, okay, there is a big problem, of course, but you can either target the different journal. You can either target the different journal, different population, different country, or you can, if you want to publish in the same journal, you can submit as a short report. Okay, you can write to the editor as an editorial short report. So it will be, additional to that original report which has been published. The best part is, target the different journal. But Google only tells us about the surroundings, not at all. Who tells the Google tells us about the surroundings? There is then you don't know how to use the Google, Mukund. If you are telling me that Google only tells us about the surroundings, not at all. You should know how to use the Google perfectly. How do we know that? Search, Akshta. How do we know that we are not missing on any literature before forming a question? Search. That's why I'm telling why, how, what. Until and unless you are not getting the answer of that, answer of anything, that is done. See, if you are getting answer of your question why, that means that is done. If you stop getting the answer for your why, that means this is something new and you can do it. You understand? See, if I'm asking why, if I'm getting the answers in the literature, that means that thing has been done already. If I stop getting the answer, that means it is something new and this is the gap. Understand? So that's how we do. Sir, can you give me some website where we can download the premium journal articles free of cost? I cannot give you. Universities have the subscriptions. Ask your university. Our university has the 3,000, 30,000 journal subscription. So ask your university and all something. They have usually. There was a website, but that website is predatory. I cannot tell you which website, we usually use. Can you help with dissertations, thesis as well? Yes, we will help. No problem at all. Okay. Guys, don't share this link with anyone else. Okay. I know who is in the class and team is taking the attendance. Okay. So don't be smart. Fine. Now someone was asking me what to do because. Okay. So let me discuss the because last and then we can close the class. So because is nothing but when you are framing a research question, keeping those four terms in mind. First is population, like in which population you are doing the study. Then the intervention, what kind of intervention you are putting. If not intervention, then comparison. Because C for comparison. Comparison could be within the groups means versus male versus female, uh uh in the elderly versus younger, that could be easily done, that could be easily done. Okay, but the major part here is in the comparison. Usually in the clinical trials we have the arm A, arm B, drug A, drug B, intervention A, intervention B, or GDMT versus intervention. So multiple things are there. Okay, and then O is outcome. Outcome is what we are looking for. We are looking for health-related quality of life. We are looking for prevalence or incidence. We are looking for efficacy of the drug. We are checking for like the success of the drug or clinical trials. So outcome is different. Okay, so these four things, if we are keeping in a question, your question will be mind blowing. Your question will be perfectly feasible, and your question will be depicting the entire study. Okay. That's the because you have to include all PICO in your study title. So it will, the person, the reviewers will just read your title and they will come to know, oh, they'll come to know the entire study because you have included your population, intervention, comparison, and outcomes. Okay. So is there any effective tip for the selection and choosing of the appropriate title of the studies? See, I have told you that is the effective way. That is the effective way. Okay, this is the effective way. Know about the because. Read the market. Market study is very important. Okay, market study. Why, how, when, where. These are the important questions to put. Okay. Okay, guys. So with this, we'll take off and we'll see you tomorrow. Take care and good night. Okay. We'll see you tomorrow. We'll take some questions tomorrow itself. No worries. Okay. Feedback form will be closed now in 1 minute. You have only 1 minute to fill the feedback form. Take care, guys. Good night. Bye-bye. No offense, in 1 minute, the question. Okay. Bye-bye. Thank you very much. See you tomorrow, guys. See you tomorrow.